Hip pain in golf is one of the more under talked about issues that we see. Obviously back pain, wrist pain, elbow pain, those tend to get more of the media attention when we talk about injuries on the PGA Tour. I'm sure as you've experienced more so in your playing groups with your fellow people that you play with on the weekends. Whatever level you are, I'm sure you're familiar with those. Hip pain tends to be less spoken about, and partly because it happens a little bit less frequently, and also because sometimes a lot of the problems in the pain in the hip, a lot of issues in the muscles in the hips actually refer up to the back or elsewhere. So the most common complaints that you'll see with hip pain in golfers are typically going to be kind of in the front of the hip. So if you see my pants here, I got a pocket kind of right at the top of the pocket there. That's a muscle called the tensor fascia lata. We'll show you diagrams of that in a minute. And then also kind of people will point to like this little bony spot here on most people call it their back. It's actually the top part of your hip. And then we'll have some people who will complain kind of right in here of some deep achiness, throbbing, those sorts of issues. So most of these issues, generally, the most common causes of these issues are typically just overuse, people who didn't have great hip rotation or hip mobility to begin with, then overstressed it, whether with swing technique and that they're really swaying and loading that trail hip, or really sliding through and really loading that lead hip. Those can cause issues in those muscles. And oftentimes even just walking, carrying their bag, just an overuse from that standpoint. If the IT band is really tight, sometimes you'll get some bursa inflammation, those sorts of things. But if you go ahead and take a look at this diagram as we pulled it up, the first muscle is called the TFL. It's short for the tensor fascia lata, and that attaches in the front of your hip and then comes down to the side of the femur, technically called the greater trochanter, is a place where it will kind of attach. And its job is to bend your leg up, and it also will take a lot of a big beating every time you rotate through onto that lead, onto either leg. And it is also what we have found, if we can release that TFL, it's probably the biggest bang for your buck in terms of increasing immediate hip internal rotation. So this is a big one that I really want you to kind of, if you need to rewind the video and just take a look at where it is on your body. If you're wearing pants with a pocket, that's generally kind of right at the top of that pocket coming down to the side. And it will cause lots of issues if you're sitting a lot, if you're playing a lot of rounds of golf, if you've taken the home assessment that we have, if you didn't do well with the hip rotation test, this is often the first place that you'll want to go to see what that tissue feels like and to improve your internal range of motion. So a little later on in this video, I'll take you through how to actually address this and the other issues we're going to talk about. But just remember that's called the TFL, tensor fascia lata, and that's where it's located. The second big issue that we see is in the gluteus medius and the gluteus minimus, which if you look at the drawing that's being pulled up right now, it's highlighted and it attaches kind of in the upper back part of your hip, kind of close to where the people will point to that bony spot. It's called the PSIS, or the posterior superior iliac spine. And that comes down towards the greater trochanter as well. And that muscle's job is to externally rotate and help with some lateral stability in the hip. So again, if we look at me swinging again, and I'm swaying really far onto the trail leg or coming really far through, that muscle will also take a beating in terms of trying to help laterally stabilize the hip during the golf swing. So if you have limitations in rotation elsewhere in the body or even in your hip, and you're swaying and sliding, or you're hitting lots of golf balls, the glute is a very common area where that tissue just kind of gets pretty gnarly and will start to cause some actual hip pain, whether it's from trigger points or if it progresses enough, you can even get into labral tears and those sorts of injuries that are more structurally based. That's beyond the scope of this video, but if you had questions about that, please let us know. Reach out to us individually. We'd be happy to help you and give you guidance on those. So and then the final is going to be, we talk about like a bursitis, where the bursa kind of gets inflamed, and that a lot of the times medically will be described as the IT band, which is the non-contractile part of the TFL or the tensor fascia lata. Sometimes the bursa around that greater trochanter can get irritated and inflamed. Very similar causes in terms of lots of lateral movement, lots of overuse, lots of walking, particularly if you're carrying a bag, heavy load, having to continually drive that hip into flexion. That can cause some issues there too. If anyone's ever foam rolled their side of their leg, generally the side of that quad and that IT band that overlays it will feel pretty uncomfortable as they're kind of stuck together. So in this next part of the video, what I'd like to do, hopefully I've made it pretty clear, a lot of the side to side sway, and even if you have a very good golf swing, I see this in some of the best golfers in the world that we work with, they have great technical golf swings, but they're hitting so many balls, their hips are just getting really, really tight. The tissue, the fascia are starting to get stuck together, so you really have to do some work to maintain the health of the musculature in the hips. So we'll go through in this next part of the video is we'll actually talk about some techniques that you can use to release these areas and to actually help to keep them healthy even before they hurt, so that you can keep your range of motion as consistently good as possible, so that you're taking the most consistent and effective swing that you can. So in order to take care of the TFL and the glute and address any kind of bursa or IT band and lateral quad issues, generally your two tools are going to be your softball and a lacrosse ball. For the TFL, generally the softball will be a little bit too large. It'll just kind of end up rolling over the TFL. So we'll typically want to use a lacrosse ball to actually get into that tissue and really create a meaningful change. So remember that tissue starts up kind of right along the front of my pocket. So I'm going to put the ball there. I'm going to come down onto the ground. I'm going to be a little bit on an angle, sort of like a 30-degree angle off the ground. I'm going to find that spot. And when I have that spot in the TFL that's a bit uncomfortable, I can kind of windshield wipe my legs back and forth, or I can cross friction over it side to side. So now by cross friction, what I mean is those tissue fibers go this way. So I want to cross friction it perpendicular to that tissue path. So that's for TFL. For the glute, you can use the softball. Generally, it's a bigger muscle, so the softball is okay. Where a lot of people actually miss, if you see where my hand is, that's where my hip bone comes up to. Your glute is anything below that. A lot of people will miss that high lateral glute, sits in a little bit of a fossa, and the lacrosse ball is the better choice to get in there just because it can dig in a little bit deeper into that tissue. Whereas the softball, much like with the TFL, will just kind of roll over it without truly getting into it. So in order to do the glute, I'm going to take the softball, get down onto my hip, cross my leg to open the hip up a little bit, and I'm going to work around till I find a spot that's uncomfortable in the glute, and I'm moving it up and down. I can go back and forth like a windshield wiper like I did with the TFL as well. Now if I wanted to get into that higher lateral area, taking the lacrosse ball, I can lay down onto it so it's just below my hip. So my hip comes up to here, and the lacrosse ball is just below that, and I can roll side to side, cross friction like I was doing with the TFL, or I can pin it and bring my leg up and down, and same thing I was doing with the glute there as well too. So don't be afraid to roll up and around that PSIS, or that little spot that most people will point to when they're having back pain, or say it kind of comes into some people describe that as their SI joint. Don't be afraid to roll up and around and explore that entire area of tissue that is all glute. Some is medius, some is maximus. The more to the side you get a little bit more of the minimus. But these two tools are going to be your ideal ones to use to address these two issues. Now if you're having some bursitis or more of that lateral leg kind of greater trochanter pain, the IT band can be a culprit there. The IT band sometimes will kind of get stuck on that lateral quad, and then they don't glide like they're supposed to. Increases tension across that bursa and can irritate it. So you can take the ball onto the side of the leg, kind of up and down here. So if I'm in this position, so you can see, I'm going to come to that position there, and then I can move my leg back and forth, bending and straightening my knee. I can cross friction side to side. If that's too difficult, you can go onto your front. So I was going to do my other side, and I can kind of come up this way. Sometimes that's a little bit more manageable from an upper body standpoint in terms of supporting your body weight. If the softball is too intense, which for some of you who are currently in pain, or some of you guys have never done myofascial work, it may just be too intense and too painful, then I'd recommend grabbing a foam roller. It's a bit of a broader surface. utilize that as an interventional tool in the beginning, and then as it gets a little bit better, it's not hurting as much, then go to the balls where you can be a little bit more aggressive and a little bit more pinpointed. So hopefully this helps in terms of clearing up some simple interventions that you can give a try for a couple weeks to alleviate your discomfort on your own, and also to maintain the quality of your hip motion while you're trying to prevent anything from happening, such as your hips getting tighter and you not being able to rotate. These are great recovery tools if you're going on a golf trip, playing professionally, playing competitively, or just playing on the weekend. These should be the first thing you hit when you get back to your room or when you get back home or to the gym as a recovery piece, in order to assure that you've maintained your mobility, recovered well, so the chance of you getting hurt is a lot less. So hopefully you've picked up at least one nugget from this video in terms of how you can either treat your current hip pain or how you can prevent potential future hip pain, especially since lack of internal rotation or lack of ability to move in your hips is one of the leading causes and predictors of low back pain. Hopefully you've picked up something that you can add to your routine to address the health of the tissue around your hips and prevent you from having any pain in the future. If you don't have pain, what I would suggest really, please at least a couple times a week, get on a ball, get on a foam roller, really check out the health of the TFL and the glute. You will save yourself so much time, money, and rehab costs, and just really enjoy the game much more because you'll be able to rotate through the golf swing technically well, swinging efficiently and consistently, striking the ball, and that's going to only guarantee that you are swinging faster, playing better, and hurting less.